My name is Dr. Gregory Levitin, and I'm the director and the founder of Open Sinus, Ear, Nose, and Throat here in New York City. We started this office dedicated to treating patients who are suffering from changes in their ability to breathe well, people who had not responded to medical therapy for chronic rhinitis, chronic sinusitis, and overall not breathing well. These are the type of conditions that we call quality of life changes. When I meet a patient for the first time, I try to help educate them to better understand the context of their symptoms. So the typical patient who comes to see me for chronic rhinitis and postnasal drip has really described a condition that's not just a cold or an allergy season or something like that. This is something that's been going on for weeks and months. Changes in their sleep, their ability to breathe, their ability to exercise, and even their ability to be in a social environment, whether it be at a restaurant, conference rooms, or a work environment. But most of these patients have been dealing with this for weeks and months. It's greatly affecting their quality of life. A lot of times, these patients have been suffering for years. They've seen other doctors. Sometimes they've even given up for a while, and they're coming back into the medical community to see if there's any other new options that may have changed. And so when we talk to the patients, we also are explaining to them their condition, explaining to them what they've been suffering from, and giving them some understanding that it's not just something that they feel, but there's actually a real diagnosis behind this. Chronic rhinitis comes in so many shapes and forms, and it affects people in so many different ways. We want to remind them that this is something that not only what they feel, but something that they now understand why that is affecting their quality of life. And so usually they go home feeling hopeful, they feel educated, and they have a better understanding, and they're more prepared to make a decision about the next steps in their care. When patients are asking about the neuromark procedure, one of the first things they ask is, well, will it hurt? Well, I tell them no. In fact, it's quite pain-free now that we have a regimen of local anesthetics that we can use that can make it easier than a dentist. These are people that can walk in and walk out on the same day, functional, meaning they're not taking any time off of work. And these are people that can go back to their job, their families on the same day. Most people describe it as a pain-free recovery, that they're breathing better after day 2 or 3, but more importantly is they actually feel normal. Like they don't feel like they just had a procedure where it was general anesthesia or a long recovery. When you take a procedure that can be done in the office, local anesthesia, and walk back to your life right afterwards, to me, that's the perfect example of a procedure and a condition that make the right fit.